you. Hello, everyone. Welcome. We're going to take a few minutes to let everyone trickle in. Welcome, you guys. If you're here, feel free to drop a message in the chat, say hello. Hey, everyone, looks like in. Hi, Chad. Thanks for joining. Thanks for the comment. Hey, Andrew. Hello, Daryl. Hello, Sherry. Thanks for joining. Hi, MD. Hello, Sarah. Awesome. Well, it looks like we've got a good amount of people trickling in. Hey, everybody. Welcome. Today, I am running this Q&A with, my name is Taylor Schumann, and I am the tech expert and editor at SeniorLiving.Org. And today we have a really exciting Q&A all about myths and misconceptions about aging. And I think this is a really great one. So excited to dive in. And for those of you who are new to our live streams, just want to give you a little bit of background on Marianne. Dr. Marianne Matzo is a distinguished expert in palliative care and a certified gerontological nurse practitioner with a career dedicated to caring for older adults, improving the end-of-life care and education. She is a retired tenure professor of nursing. She has extensive experience as a hospice and palliative care nurse, researcher, and educator. And since retiring, she has also founded Everyone Dies, which is a nonprofit organization dedicated to educating the public regarding serious illness, dying, and bereavement through weekly podcasts and a children's book. So welcome, Marianne.
Thanks for having me.
Of course. And I just wanted to leave up, there's a QR code here. You can check out Marianne's nonprofit. It has so many incredible resources, really great podcast. So feel free to check it out. All right. So today we're going to address some of the most common and also surprising myths and misconceptions about aging. So if you have any questions that come up as we're talking this through, maybe you just have comments or things you didn't realize about these myths, feel free to leave your comments in the chat. You'll just need to be signed into a YouTube account in order to join. Otherwise, the chat won't be available to you. So feel free to pop in at any time. And in the meantime, we will get started. So before we dive into those myths, Marianne, I would love to know why you think there are so many inaccurate stereotypes about older adults that persist.
Well, I think there's a couple of things. I'm probably older than many people that are here. I don't know, but when I was growing up, I only had, by the time my last grandparent died, I was in the 8th grade. So you didn't see that many older people. Older people died. In my father's family, they died in their 50s. And so it's always a thing of you don't know really what that's all about. Sort of some of the same issues as with dying, where you're like, we don't know exactly what's going on after death. So the whole idea of it is very scary to us. And we look at older people and we see kind of, whatever lens is through whatever lens is in front of us. So if you're a nurse who's working in a nursing home, you're going to think, well, what I see are sick old people. And so that's what most old people must be. And then you might say, well, and I don't want to be like that. Well, less than 5% of all older adults are in a long-term care situation, are living in a nursing home. So that's a very small percent of the population, that if that's who you're working with and that's who you're seeing a small little part of aging older adults. Then you look at what are the things that we fear, and especially as Americans, we got to fight the wrinkles, we got to fight the gray hair, we got to not look our age, cosmetic surgery, cosmetics, injections, anything we can do so that we don't actually look like who we are. And so there's this thing of like, well, yeah, I might be 80, but I sure in heck don't want to look like it, and I don't want to walk like it, and I don't want to talk like it. I want to be, young and hip and match what's in my head. Younger people looking at that say, well, if this is what's coming down the road for me, or if you're in the sandwich generation, you're caring for older parents, you're looking at that and you're saying, well, if this is what growing old is, then I don't want to do it. I don't think people ever stop to think, though, when they say, I don't want to do it, that the other alternative is death, which is the other thing that we're really afraid of. So you got to almost, I don't want to say you pick your poison, but don't complain when you have a 50th birthday or 60th birthday or 90th birthday. The alternative may be worse, maybe better, I don't know, but the alternative is death. So if you're here and you can celebrate, it's great. It's wonderful. Let that older age part, whatever is in front of you, embrace it. Say, what is this next part of my life going to be? Instead of saying, oh my God, I'm 65. This is the end for me. I might as well just get me a good lazy boy chair and a clicker, a remote, and maybe put a fridge next to the chair so I don't have to get up so much. Why would we do that at 65 if we haven't done that all along? So and it's the misconceptions that we see on television, that we see in advertisements, that like I in our nonprofit, we work with an artist, and I when we first hired her, I said, nobody has canes. Don't put every older person in a wheelchair with a cane. I mean, I'll say nobody has a cane. People have canes, but you're perpetuating the stereotype rather than embracing what's the actual fact. And so when you see those things yourself, I mean, I'd love it if everybody wrote letters and said, you're perpetuating a stereotype. Don't do that. Get rid of the old person in the shawl. That's, at least put her in a nice sweatshirt or something different,
Totally. Yeah, it's so fun to watch. My grandma turns 90 this year, and she is so vibrant and is enjoying life so much and is really independent. And she's very blessed with health, great health at that age. But it's been so fun, I think, for me to watch her get older. And in that fact, it's broken down so many of the myths that, you hear over and over again, because she is just loving life. So I'm excited to get older, but yeah, lots of things going around that people don't realize are just even as simple as a cane or a wheelchair in a photo can be just kind of inaccurate to the total population. So
right.
Awesome. Okay, let's jump into some myths here. I'm going to have a myth up on the screen, and then if you want to chat maybe a little bit about the reality of this myth, where it comes from, anything like that. So the first myth is that aging always equals illness and disability.
So because, depending on, I don't know what everybody's job is or what it is that you see, if you're working in a hospital and you see older people coming in with, broken hips or something, that's your life view. That's what you see, that's what you know. But what you're not seeing is all the rest of the people who are line dancing, swimming, doing a wide variety of things. So the statistics, I kind of am a bit of a nerd. I like the statistics. So 3/4 of people who are ages 75 to 84. So 75 to 84, 3/4 of those people have no disability. No, they're fine. They're like grandma. They're doing what they're doing. They're living life. They're enjoying themselves. They're living life. And so and when you look at, well, so those people who are sick, those people who are in the hospital with a broken hip or whatever has happened, well, how come 1/4 of the people are that way? Well, so you look at the research. What we know is that age brings a greater risk of disease, but it doesn't always bring disease. So I teach gerontology to undergraduates, and they'll write, old people will. And I always correct, old people may. This may happen. There is a huge long list of things that may happen. And some of them are more likely to happen as we're older. But age is not destiny. Age is, that how old you are. Like if you say grandma's 90 years old, well, that's one piece of data for me about grandma. So age is nothing. Sound like a song, but age is nothing but a number. That it's a number. It's a piece of data that says, okay, here's how old this person is chronologically, how long they've been on this earth. But how old is their body? How old is their mind? How old are their joints? Because those things then bring in a fuller picture of what an older person is able to do. So the reality is, and the research is more and more documenting that we are making our own old age. Taylor, you are making your own old age right now. Now, I don't know what grandma did back when she was your age, and it'd be great. You can ask her and then send me an email because I want to know. But people who exercise, people who eat relatively clean, because who eats clean all the time? People who don't smoke, people who are engaged with other people, talk to other people, talk to strangers, whoever you need to talk to, people who are needed by other people. Those are the people who age well. And so if you're 20, 30, however old you are, look at yourself and say, I'm writing my script for my old age right now. And is it a script that you want to live in your old age? Now, that's not to say that it's not to say that, I don't know, it's not bad, but that you won't get hit by a car or there won't be something that cuts that short, because that's always a possibility. But if, assuming nothing of those kinds of things happen, and you stay on this track, this is who you will be as an older person. So in gerontology, we say that aging is like the aging of wine or cheese. It's what you always were, but only more so. So, if you're inactive at age 25, then how active are you thinking you're going to be at age 70? And will you make it to age 80 if you live in an active lifestyle? So, we've talked about money a few weeks ago and said, well, you're making a decision now, right? How you manage your money now. Are you putting away for retirement? All those things we talked about. And if you missed that one, it's recorded. You can go listen to it. So think of your body in that same way. So back when I was young, people smoked all the time. My mother used lard and butter to make everything. Foods were fried. We thought it was the greatest wonder of the world when McDonald's was invented, and it's the greatest treat to go eat it. I know I'm really dating myself here.
I love
But
it.
that was our reality. We didn't know. We didn't have this research to say, oh, well, here's what will happen, which is why those people in my family died young. Okay. But now there's if you've seen the Harvard nurses study, that started about, I was in my 20s when that started. So let's say that was like 40 years ago. I think it's just having its like 40th anniversary. And so what they did is Harvard had this look at these Boston area nurses, and they did a whole battery of tests, and then every so many months they'd mail us another one. So they've been following us for a long time, for 40 years. So they're able to say, well, okay, so the people who die of this, people who have a lot of broken bones have a large Diet Coke consumption. And that's sort of accurate, but not completely. I sort of embellish that a little bit. So, but there is the fact that the Diet Coke, the sulfates in Diet Coke kind of leach the leach your bones and make them weaker.
Wow.
But yeah, I know. It's very sad.
It's sad.
So so you look at these studies that are now coming out that say, okay, look over time. Here's what we know. People who smoke. Here's what we know. People who, have a certain kind of diet. Here's what we know. And then you make a choice. Don't be surprised down the road if certain things are happening to your body when you have the data to know these behaviors are going to impact my old age. So deaths from cancer, cardiovascular disease make the largest contribution to years of life loss and have the biggest life expectancy on or have the biggest impact on life expectancy. So deaths from cancer and cardiovascular diseases. So what impacts that? Our activity, our weight, our smoking, our diet. It's so boring. Like, I would love to say, we figured out this, eating cilantro will kill you. Like, give us something different. I'm serious. People are sick of hearing, come on, there's got to be something other than those things. You know what? There's not. There's not. And so, like tobacco use is a risk factor. Largest contribution to life loss in both sexes, followed by high body mass, which is obesity, high cholesterol, and high blood pressure. And the link in between the obesity piece of it, you say, well, what's that about? Well, what we know now is that being obese puts your body into this chronic state of inflammation. And inflammation is the thing that then can set off a whole cascade of issues like heart disease and cancer. And so you think, well, I'm overweight, but at least I don't smoke. Yes, that's great. Pick your sin, whatever it happens to be. Mine's Diet Coke, so I'm still grieving over my bones. So, um, but I've had so many patients sit in the chair in oncology as I worked as an oncology nurse practitioner who would say, if I really believed that the smoking was going to cause me to be in this chair, I would have stopped earlier. And it makes so many things go through my brain when I heard that patient say that. And I don't just hear it once either in my career. I would hear this. It'd be like, so you didn't believe essentially what the study said about the correlation between tobacco and lung cancer and heart disease. I don't say this. I just have this active brain that has these conversations with itself. And so because they didn't believe that those studies were true, or that they believed that it wasn't going to happen to them, they continued to smoke. Then they had lung cancer, and now they're in my chair. So I guess that's a part of also we get to, kind of choose I guess we get to choose what we believe. But I'm always an advocate that of science, and as a researcher myself, is that, it's so difficult to get funding, and it's so difficult to get through the IRB, and it's so difficult to run research that and it's not to say that there haven't been researchers who have lied, but we've then find them out, and then people still believe lies. So that's a whole other story. Anyway, look at the research, especially the longitudinal research, the ones that they look at over a long period of time. And I think that those are, at least to me, they're believable. And from my experience, these things that I mentioned to you, these are the things that cause problems in old age.
Definitely. So, like you said, it's kind of all about your choices. And I love one of our viewers, MD, commented, I love that saying, age is not destiny. And it's not. It's about, like you just said, all of the risk factors, all of the decisions that we make. along the way. All right. So, second myth, changing your habits when you're older doesn't have any physical benefits. So, basically, like you can't teach an old dog new tricks.
Well, you know, so we all know you can teach a dog new tricks, but there are people who will say, patients will say to me, I've been smoking for 40 years. I started smoking when I was 12. It's not going to make a bit of difference if I stop now. But that's not true. If you continue to smoke, you continue to do damage to your lungs. Now, will you be able to clean up the damage that was done to your lungs from those 40 years of smoking? Some of it. The body is a pretty incredible thing in terms of being able to clean some stuff up, but not all of it. Some damage is going to be there, sometimes a lot of damage, depending on how many packs you smoke, packs of cigarettes you smoke. So, but stopping a bad behavior, see, that's judgmental. Stopping a behavior that is not maybe in alignment with your goals will make you a little bit healthier. And I've had patients who've said, well, I have lung cancer now. Why should I stop? Why should I stop smoking? I already have the disease. Well, but you're sitting in my chair getting chemotherapy, and your chemotherapy is going to work better if you're not smoking. Because what you're doing is you're adding another inflammatory carcinogen into your body every time while I'm pumping in chemotherapy. I mean, that doesn't make a whole lot of sense to me. But, I can see where you say, well, I'm already sick, might as well keep doing it. Well, except if you're getting chemotherapy, your chemotherapy is going to work better if you're not smoking. So what do you get out of quitting? So I got some statistics for you. So fitness, cardiovascular fitness, going for a brisk walk, going for a run, whatever kind of makes you breathe a little bit heavier. You can have, in terms of adding years to your life, you can increase 10 to 30%. Makes a
Wow.
difference. So even if you're 65 years old and you just finally retired and you say, well, now I have time for fitness, go do it because it'll keep your joints working better, it'll keep your heart working better, it'll keep your lungs working better, your muscles will be stronger, and you'll live a little bit longer, assuming that you want to. I mean, I don't assume that everybody wants to,
Yeah.
but usually people want to. So when it used to be, back when I started in gerontology, there was this belief that once you lost muscle mass, you could never get it back. And then they did this study where they brought gym equipment into the nursing home and they had people working out with weights. And you know what happened? People built muscle mass. And everybody was like really surprised. Look, you can not have it, but you can build it back. So, we know you can't store fitness. We know you can't, if you stop lifting weights or stop doing aerobic activity, you don't store it so that, oh, good, it's here and I don't have to do anything for a year. It doesn't work that
I
way.
wish.
I know, you lose the benefit, right? So what they did is they did strength training with 80 to 90-year-olds, and their strength, it tripled with bodybuilding. Tripled with 80 to 90-year-olds.
Wow.
I mean, I think that's pretty impressive.
It's
That's a good
amazing.
reason. And we talk about this on our podcast a lot because people are like, oh, I'm afraid to die. I don't want to die. Who wants to die? But if you don't want to die, then how about we do some changes in our lifestyle so that maybe we live a little longer? It's like, well, yeah, I don't want to die, but I don't have to do that either. But there's simple circuits of weight training that if people participate in 3 days a week, really shows incredible benefit in terms of muscle mass, balance, decrease in falls, which is pretty impressive, I
That's very
think.
impressive. Yeah. That's 3
Um,
times the benefit. That's
3 times, yeah.
crazy.
When they looked at mental, like, cognition, being able to think and process, performance recognition, recall, showed little decline in the people who were exercising. Um, and mental and physical exercise helped to prevent any further decline. So if you're saying, I'm having trouble with my memory, those kind of games that you can play, word games, search games, that kind of thing, those are great. Going for a walk, also great.
I love that because I'm not very good at all the word puzzles and things like that. So if I can go on a walk instead, that's great.
Yeah, well, I don't know that anybody's put the two head to head and said which one's better,
Totally.
but both work.
Yeah.
So if you don't like the word puzzle, go for a walk.
Amazing. I love that.
Do
Oh,
people oops, I'm sorry, my
oh,
chair
go
rolled.
ahead.
Do people have questions as I'm blabbling along here?
Yeah, if anyone has questions about any of these myths, or maybe you want to bring up other myths that you've heard, please feel free to drop them in the chat. We can pause and answer any new questions at any time.
Absolutely.
Okay, so while we're waiting to see if anyone has any other questions, let's look at this next myth. Aging equals a reduction in mental sharpness.
Oh, actually, you know what I did is I was talking about, the physical activity. I gave you sort of the spoiler alert and gave you the answers that physical activity really helps with that. But, only about 20% of older adults have Alzheimer's disease or any kind of, cognition kind of problem with that. And I say only, because it's still, 20% is still a major disruption in people's lives. But that means, on the other hand, that 80% do not. 50%, though, have some sort of cognitive decline. So meaning that, um, we sort of peak in our bodies, in our brains at age 30, which, if you're over 30, you can think to yourself, okay, so that peak was a little while ago. But you only lose about 1% a year thereafter. And if you can appreciate how complex our brains are and how complex our bodies are, there is a large body of literature that talks about how much brain loss in terms of disease one can have before you even show symptoms. And it's something like 45%. So think about that. I mean, we don't use all of our brains in the first place, and maybe in the sense of changes in cognition as we grow older, maybe it's just all redundancy that we're carrying around with us in the event that, something goes wrong and that we're gonna need it, which is great design, that I always look at when I get a new car, it's like, "Why are there 3 ways to do the same thing?" Our brains are the same way. There's multiple ways to do it, and our brains are able to work around sort of the parts that are damaged. So that's pretty amazing. So it's a small percentage of people, having, n you know, drug use, alcohol use are both things that are gonna cloud, um, your brain in terms of how well it functions. Um, so those are things to pay attention to, and then, like I said, maintaining your physical activity helps keep your brain stay sharper.
Totally. Very, very cool. All right, we have a few questions. Thanks, guys, for jumping in the chat. MD would like to know, do seniors need more or less sleep? I've seen some articles that are contradictory. I feel like there's a new article every week about sleep, so this is a great one.
It is a good one. Um, I don't think that we appreciate how important sleep is. They're finding more and more about what the brain does while we're asleep in terms of think of it as a sort of like a big toilet flush of all the toxins and things that are in your brain, and it needs a certain amount of time in order to do it. So it's like if you're cleaning out your Keurig, you can't rush that. You've got to go through every single step if you want to have your Keurig clean. And the same is true for the benefit that we get from sleep. Now, you can be one of those people that say, "I've never needed a lot of sleep," and there are some people who, by their genetics, don't need a whole lot of sleep, but that's very different. What I would say is get a full 8 hours sleep for, let's say, a month, because nothing really changes. You don't feel benefits of change. Usually need about 30 days. Do it for about a month and then see, does it really make a difference? Because if you only get 8 hours sleep once a week, you're not going to see a difference in terms of your body being able to completely rest, completely shut down, and go through its cleaning process and get into those areas of what's called restorative sleep. So we see a lot of, there's articles all the time, and the ones that I see, I don't see them saying, well, really, it's not true. You could sleep 5 hours a night and you'll be perfectly fine. What they do, though, is they reinforce the importance of sleep, the importance of what's called sleep hygiene, like not exercising at night, not having caffeine late, uh, things like take a warm shower at night to help you relax. The hardest thing I think for most people is turning down their lights. We're animals by nature. We're used to, way back, getting up with the sun, going to sleep when it's dark, because we didn't have any other choice because there wasn't electricity. And so then comes electricity, and sort of that biorhythm starts to get thrown off. And so the lights from your computer, the lights from your phone, the lights from your TV activate neurochemicals in your brain that says, oh, there's still light. I have to still stay awake. And so then it's harder to go to sleep. I know people who sleep with their TV on. Oh, God, it's really not a good idea that you should do that. You really should not even have a TV in your room. What they say is the bedroom should be for sleep and sex. It's a little narrow on the sex part, but who am I to judge? But your bedroom should be for sleeping and not watching TV, not eating dinner, not whatever ever else goes on. I know some people that just like, I always, think of that Willy Wonka movie where everybody's always all the grandparents are in bed and they don't ever get out. It's like,
Yes.
they hang out of bed sometimes, walk around. So I think I got out. Oh, sleeping. Sleeping is really important. Make your room for sleep. Shut off your devices like an hour before, which I'm saying it and I know how hard it is. So I think, oh, I'll just check X, and then I go in a black hole of Y or whatever. But the best sleep is when you do that, you let your body do what it's going to do. The melatonin um, increases in you, and you're able to have a good night's sleep.
Totally. As someone who needs the 8 hours or I am just a mess, I totally get this point. Okay, let's see. Sherry asks, is the Montreal Cognitive Assessment a good tool to assess a senior's mental sharpness and fitness?
Well, so I don't know, Sherry, if you're asking from the point of view of you want to see if somebody in your family has a good mental status, or if you're looking for it for professional use. The general tool that's used as a screening tool is the mini mental state exam, and it's the one that you'll see people doing on TV. Count backwards from 100 by 3, um, repeating certain words and then being told to remember them, and then having to say them back, following simple 3-step commands. There's about maybe 10 different things that are on that. So that's the one that's generally used for general screening. So, Sherry, you can always, if you want, email me and we can talk about like what you want to use the tool for and that kind of thing. But in general, that would be the one that's just for screening. Like, how's this person doing?
Makes sense. Okay, another question, kind of related to sleep. Simone asks, does caffeine become more harmful as we get older?
Well, that's where I see a lot of studies going back and forth is caffeine. It's like, well, it's good for this, it's not good for that. I would go from all from my reading in terms of the field of gerontology and looking at all these things is moderation is probably the best answer for the caffeine. Is a cup of coffee bad in the morning or tea or whatever? I don't know, Red Bull's probably a whole other story. Um, no, like in moderation. If the only thing you drink all day is a caffeinated drinks, well, then what you're doing is that caffeine is increasing your heart rate, and it's also increasing the inflammation in your body. So from that point of view, no, that's not a good choice. But and it and from the studies that I've seen, I don't see where it's age is the factor for whether or not you should be drinking caffeine. It's more of, are you having anxiety? Do you have heart palpitations? Do you have some other symptoms that makes it contraindicated that you should be drinking caffeine and not age?
That makes sense. All right, so let's see. Another myth that I wanted to ask you about, being old leads to being sad, lonely, and unproductive.
Well, it's not a function of age. It's a function of your living circumstances. And like I go back to the wine and cheese, it's a function of how have you been living your life. So I've said before, less than 5% of all older adults are living in an institution. One third of elders are still employed. One third volunteer regularly. Um, Only about 8 to 15% report loneliness, depending on what surveys being done and that kind of thing. But isolated older adults have a 2 to 4% higher death rate than people who are not isolated. And so it's the isolation. It's, in fact, I just read an article recently about it's about being needed. It's like if somebody, if an elder's in a position where they can help somebody else, that is a more important factor than even the loneliness factor. And think about, you know, I mean, do we really utilize our elders, the elders that are around us as well as we could? Do we ask them questions? Do we ask them for a recipe? Do we take cookies over and have a 5-minute chat? If you think about how societies have changed, I grew up outside of Detroit where all the houses were just built on the grid, and everybody had the same size backyard, and people would literally, my mom and the neighbors and I and the neighbors would talk over the fence. And, here, share this with the person next door, or while you're, because the backyards really were not that big, while you're weeding, you could chat with somebody. So there was that opportunity to share with your community. And so I often think, I look and say, well, we're so busy and so in a rush and so looking at our phone. Do we look up enough to say, who's around us that we could interact with? And so it's not that because we're old, we're sad, lonely, and non-productive. It can be a function of our personality. It could be a function of our opportunities. It could be a function of, I want to talk to people, not text somebody. So is that the factor? But there's nothing that is inherent in growing old. that makes you that way. You can have very young people who feel the same way. It's the circumstance.
Yeah, that makes sense. And I know the older adults in my life, taking the time just to ask, whether it's questions about their childhood or their favorite memories or what, it just makes such a difference. You can see them light up. And so just giving space for those moments, there's so much to learn from them too. So it's such a benefit to us and to them. So I love that. All right, this one's kind of tied to this last one, but if you have anything else to add, depression and suicide rates are higher in older adults.
Well, so this is a little bit thornier in terms of older adults, especially older adult men, will, if they try to commit suicide, they complete it. Younger people, women also, will have more attempts. And so that's why I says it's thorny. It's a little bit more confusing because it seems to be that when an older man decides that he wants to end his life, he doesn't mess around. It'll be sort of more violent kinds of deaths because they want to make sure that what they've decided is what's going to happen. Depression is blamed for an increase in suicide in older adults, but depression is common and rampant throughout any age group. They call depression the common cold of mental health because everybody gets depression at some point. At any time in any group, it's a 25% odds that there's somebody in that group who is depressed. So, white males over the age of 65 have the greatest risk of completing suicide. Women attempt suicide more, but men complete it 3 times more. 3 times more.
Wow.
And elder suicide is twice the national average for suicide rates. So, it's that factor of, especially for the men, when they say, "I'm done," they make sure that there's no coming back from that, if that makes sense to you. So it is a problem, and part of the problem comes from, not assessing older people for depression, not doing the screenings that we do on younger people with older people. And that's part of the ageism in our society. It's like you not screening older people for HIV or other sexually transmitted diseases. Like, why do we have to ask old people about that? They're not having sex. Like, I could tell you stories. Yes, they are, and with multiple partners. So that piece, like that the HIV sex ed talk that we think, oh, we have to do it with the young people. Well, we really need to do it with the old people too, and it doesn't get done.
Yeah, that makes sense. We can jump ahead to myth number 7 that I had as we are kind of transitioning to that. That seniors are not interested in sex and they couldn't perform it even if they were.
Well, got news for you. I can remember when I had nursing students in Massachusetts, and it was sort of, this nursing home was like away from the street, but if you went up to the street, there were ladies of the night. And one of my students was telling me that her patient told her that he went walking and one of the women approached him and offered him a certain sex act, which I don't know, I'll tell you, but I want to be invited back. Anyway, so he said, no, thank you, that, you can get AIDS that way, and no thanks. And so I guess when she was doing her sexual health assessment, which I required students to do on older adults because, as I said, they are still active. She said, so she reports this in post-conference, and she said, "And he even knew what that was." And I said, "Your generation did not invent that sex act."
Oh my
So,
gosh.
um, I'll give you some statistics. 79% of men who are ages 70 to 90 years old and 69% of women 70 to 90 years old either masturbate or have sexual contact on a regular basis. 86% expressed interest in sex. Two-thirds of married respondents of the sexual surveys that they've done of older adults said sexual relationships made life meaningful. And 72% said 75-year-old men and women were sexy. So, we look, depending on your age, you look at, somebody and you say, ugh. And then, but if you asked grandma, hey, you think he's sexy? She might say, yeah, I wouldn't kick him out for eating crackers in bed. So it depends on your perspective. It depends on your view in life. Now with Viagra, men can perform whatever they want with help of with a pill. Women, after menopause, the issue for many women is vaginal dryness, so that intercourse, if that's the way of sexual expression, becomes painful. And because, again, people don't ask when they go to their primary provider, hey, are you having any problems expressing yourself sexually? The older adult doesn't bring it up because they figure, well, if you could help me with this, you'd ask me about it. And the healthcare practitioner, whoever they are, says, well, if they had a problem, they would tell me. And so I did some research on this in the past, and I called the article, "If you don't ask, I'm not going to tell," because both groups were just saying, well, the other person will bring it up if they want to help me. And so then the elder goes home and they still have painful intercourse and don't know what it is to do. So we do have a podcast about that. And if you want to have a sex live talk, I won't say live sex talk because that would probably not
Not what we're doing here.
not what we want to do. But if you want to, if people have questions about that, that's certainly something you can go more into. But we do have a podcast on that. You can look it up on our website. In terms of what are the ways to manage vaginal dryness so that you can continue to have intercourse if that's how you like to express yourself sexually. So people are interested. The one of the primary issues in older age is that men die younger than women. And so if you're so if you want to have sexual relations with the opposite sex, that might be a little hard to do if your ratio of men and women is really thrown off. There have been gerontologists, who have suggested that we should talk to women about sexual expression between women so that they can continue to have a partner. And I think, especially in the group of elders that are living right now, is that if we wanted to do that, we would have figured that out by now.
Yeah.
Nobody has to give us, the baby boomers, nobody has to give us permission to try whatever we want to try. So in previous generations, that might have been something you could say, well, have you thought about, Mabel next door? But we'll think about that on our own, I think. But there are things you can do if you're motivated to still express yourself sexually. You certainly can. Some people will say, I'm so glad that part of my life is over because I never liked it in the first place. But that goes back to the aging of wine and cheese. They never liked it. When they were 20, they didn't like it. So why are they going to suddenly at 70 say, all right, let's go? They're not. It doesn't work that way.
Totally. Well, just a reminder, Dr. Marianne's podcast is called Everyone Dies if you want to check it out and see her other resources on this topic. So let's look at one more myth and then we'll wrap up here in just a minute.
Yeah.
The last one I have is that people become rigid and narrow minded with age, which is something I hear a lot.
So that is a myth. Our personality traits remain relatively consistent throughout our lives. I just went to a family wedding in Michigan and saw a, a brother-in-law who is on the road of dementia, and he was talking with my daughter, and she said, "I'm Marianne's daughter." He said, "Oh, she was the sassy one." So, he met me when I was a teenager. I'm still a sassy one. I'm not gonna be unsassy in my old age. Um, Anthropologists believe that the age that age is who we are is ageless. It's just this continuous road. Um, and also, older adults have little change in their self-image with age. So if you've perceived yourself to be kind of a hotsy-totsy kind of mama, with the lipstick and the bangling jewelry, whatever stereotype you want to put with hotsy-totsy mama, you're going to still be that when you're 90. You're going to still like your banglies and your red lipstick or whatever. If you were somebody who had a more sedate way of presenting yourself, then you're going to continue to do it that way. There's always the possibility, though, that you put parts of yourself on hold when you were younger because of money or because of who you're married to or because of your children or the number of children you had. And there was this part of you always within you that said, I want XYZ. And so then when you get to a point where you have the money and there's nothing else that's holding you back, that you say, I'm going to do this now. It's not that you've changed and all of a sudden you're taking cha-cha lessons. What it is that you've always wanted to take cha-cha lessons, but the opportunity didn't present itself or the situation wasn't right that you could. So it's not that she changed or he changed. It's just that they deferred what they wanted until they could have what they wanted.
Totally, that makes sense. I love that you said, I forget how you worded it, but our personalities are ageless.
Mhm.
Yeah, that's
Yep.
really cool. I love that.
Yep.
Awesome. Well, this has been super insightful. It's been really interesting. And we would love to have you guys join us again for our next live stream. And I just want to throw a few resources your way as well. We have a Facebook group called the Caregivers Corner that's designed for caregivers. It's a place where you can come and hear from experts like Dr. Marianne, talk to other people who are caregiving, and it's really, really amazing. I'll also drop the link in the chat if you aren't able to scan that QR code. And then we also have a course. So if you are a caregiver or you know somebody who is new to caregiving, I think most of us know that journey can be really, really difficult. So if you know someone starting that journey, this course is designed to equip you with all of the information that you need to get started. So I will drop that link in the chat as well. But other than that, I just want to say thank you all so much for joining. Thank you, Dr. Marianne. Again, it's always a pleasure.